Well, good afternoon, everyone, and welcome. I'm Tom Schreier, and I have the privilege of leading the Inspired Leadership Initiative here at Notre Dame. It's our program for those who have completed their chosen career and look to return to campus for an academic year to discover, discern, and design their next act. I want to sincerely thank you for participating in our Inspiring Conversation speaker series, where we will spend this semester discussing leading people in an ever-changing world. It is our hope that we will build a virtual community and connect with people globally to reflect upon the material presented. We're excited and humbled by the amount of interest in this program, as we have over 600 participants registered, ranging from ILI fellows to alumni to faculty to students and friends to join us over this fall semester. We're also excited to share that our community has over 16 countries from around the world represented. We've designed today's conversation to have as much interaction and engagement as possible, facilitated by having an interactive breakout session later. We hope that you'll find your experience as part of our community to be both engaging and inspiring. And we're looking forward to getting to know you over these next few weeks in this semester. Before we start, I want to thank all of those who have put in so much time and lent their talents to bring this program to life from its original conception. I'd like to particularly thank the Alumni Association for all the thought and all the work that they have put into ThinkND. Now, just a couple of technical items. You are all muted by the host to facilitate a smooth program without background noise. Later in the program, we will have a 10-minute breakout session so that you can meet each other and discuss today's topic in smaller groups. Should you not wish to break out, you may stay in the main room by declining to enter the breakout session, and you can reflect on the topic yourself or with those you have gathered with. Also, we recommend that you use Speaker View in Zoom, as that will highlight our speakers as they come on screen. Lastly, we ask that if you have questions for Penny or me, please use the Google form that we are sharing with you now via the chat function. This will allow us to facilitate the questions as effectively as possible. We will try and answer as many of them as we can, given the time constraints. This week, I'm delighted that we have the opportunity to discuss embracing the mind, body, and spirit through healthcare, navigating a mission-driven system through dual pandemics with Dr. Penny Wheeler, the President and Chief Executive Officer of Allina Health, the Minneapolis-based healthcare system that I also have the privilege of serving as the chair of the board of directors for. Together, we will explore how to ensure that Allina works to ensure it can meet its evolving mission now and into the future. This promises to be a powerful discussion given the challenges posed by the COVID-19 pandemic for healthcare in general and for Allina specifically, coupled with the desire to ensure that it maintains a focus on the need for racial equity, as was brought to global light by the killing of George Floyd in its own backyard. And now I'd like to welcome my colleague and friend, Dr. Penny Wheeler, the President and CEO of Allina Health. She is a truly mission-driven leader who takes to heart serving the community. She has been surrounded by Allina literally from her birth at its flagship hospital, through her years as a clinician in OBGYN, and now as its CEO and president. She leads with compassion and humanity to foster an organization that is an authentic force for the betterment of each individual that walks through its doors or is part of its broader community. Penny, thank you for joining us today.
No, it's a privilege to join with all of you and with you, Tom. It's a privilege that I get to work beside you. So thank you for this opportunity and that work we do together.
Well, I thought before we dove into the specifics, maybe you could just spend a minute kind of painting the picture of the organization and the culture that you've created at Allina.
Yeah, you know, it's a wonderful, very mission-driven organization, as are many in healthcare. We always say that our culture is kind of defined by being high on performance needs and low on ego needs as a moniker, and we really fashion ourselves as trying to care for individuals holistically, mind, body, spirit, and their connections to the community. One of my mentors early on said that I think healthcare is more about love than anything else. Because at the end of the day, if it's not one person trying to relieve the suffering of another and attend to their well-being, and that's not love, I don't know what is. That's what, at our best, we say, we surround you with all the things you need and make you feel loved. And we have, one of our greatest assets is the 28,000 people who work to do just that in direct caregiving or supporting the care of our community. Includes our board of directors as well, Tom.
Well, thank you, Penny. I know from working with you that Allina, like healthcare in general, and honestly every industry, faces a kind of specifically challenging environment today with both the COVID-19 pandemic and the recent killing of George Floyd, which brought to light what I mentioned earlier, the need for racial equity. Maybe just talk a little bit about how Allina is addressing and operating through both of those.
Yeah, well, this is certainly no ordinary time. As COVID came upon us, the anxiety of how we would best serve the community when they needed us most was acute. As you know, we were trying to understand quickly a virus that we still incompletely understand, trying to make sure there was a safety for our staff when things like personal protective equipment was in short supply, trying to actually be able to have enough space, stuff, and staff to take for ailing community, and worried that depending on your geography, that this was going to happen so quickly that it would quickly overwhelm our resources. So it was really hard. And then we had the unevenness in our business of having to gear up, and we doubled our intensive care unit capacity, increased our medical surgical capacity by 50%, worked, which I loved, with other healthcare systems well in our state to even that out. But still there were significant challenges in that you had this bulking up of part of your organization, and part of your organization was actually didn't have any business at all with scheduled surgeries to preserve critical equipment and space for people there. So we were talking about furloughs and layoffs. The same time we were talking about not having enough staff for other areas. So it was very, very difficult. And just to paint the picture further, my chief human resource officer said to me, I just have to say for a minute, Penny, can it get any harder than this? Can it possibly get any harder? And then on May 25th, George Floyd was killed, just blocks from where our headquarters was. And the civil unrest that it resulted in Minneapolis and in several areas around the country showed that yes, there was a pandemic we were dealing with in COVID that disproportionately affected people, by the way, who were Black, Indigenous, or people of color. And now we were having our eyes wider open on the racial injustice too. And this was literally outside our front door. We had chosen years back to locate our corporate headquarters next to our premier hospital, one of our 12 hospitals that had the most required the depth of complex care the greatest. And that was right on Lake Street, which for Minneapolitans was the most savaged area in the civil unrest. And it got very frightening. In addition to COVID, then we were dealing with not knowing that all of our protective equipment, which was gold, was housed in a warehouse that was 1 block from where all the unrest was going on. And we were worried. There was also an oxygen tank there. Could that go up in flames? We had 500 patients at the hospital that was located there. We had to locate pallets of protective equipment, 100 patients, and plead on every favor possible with our senators and governor to get National Guard presence to do that. So it got very complicated. even more complicated than with COVID. And there was a dual pandemic. So I'm not missing out on the gravity of financial challenges that have associated with this, Tom, but our eyes were wider open on what the community needed from us, not only to deal with the pandemic of the virus and other health issues, but also to deal with the pandemic of racism and systemic racism and what that meant for the delivery of our services. So got hit between the eyes in a lot of different ways. And sometimes and hoping that distress, actually knowing that distress will make us far better in service of our mission.
So Penny, on a human level, talk a little bit about how somebody in a role like yours navigates through a situation like the situation we've recently been faced with, and how you're able to, manage all the different constituencies and stakeholders that are affected in an environment like this. I think our audience here would be very interested to hear how you do that in the middle of an environment like this.
Yeah, I think it's really comes down to just a few key things, that I try to always keep in mind. First of all, it's what never forget who you're serving and why. So that's always continual focus on purpose and how to align purpose is just hugely important to what your work is. And as importantly, or probably even more importantly, connecting the people's work that you work beside to that purpose and showing them, whether it's a matter of, in our case, a direct caregiver, and showing the gratitude for them. And many of them are not only giving direct care, but because we had to limit visitors, being family members, basically the people we're serving. Or it could be shared sacrifice. People who were placed on furloughs, but at least connecting that furloughs to a sacrifice that makes us as a stronger organization. Or it could be on people who are looking at equity with a broader lens, saying, okay, I know what we're supposed to do to close disparities gaps as a provider, but what could we do as an employer further? What could we do as a purchaser of services? Or what could we do as a community member further? So always the first thing I would say is that purpose and connecting people to the purposeful work. The second thing is really directly engaging with the people that are on the front line. So you just never lose touch with that. I said that I might sometime write a book about the good leadership in my mind is having a thin skin. Really trying to connect with the people closest on, learn from them, learn what's challenging them, learn what opportunities there are, and don't take it personally, but actually take it as an opportunity to improve, on what you're doing. So I think that the more we learn and deeply understand from the people who know and are closest to the work, the better we can do that. And a quick example of that is, we had as Tom knows all too well, we had a nurses strike 4 years ago here. I was was 20 years practicing next to nurses, and then was CEO during a nurses strike. And there's nothing worse than having people you care for inordinately and value so much thinking you don't care about them. And I quite frankly thought, have I lost any kind of touch with what they're feeling and going through since I stepped into administrative positions? So I initiated after the strike focus groups with nurses, and we meet every quarter. There's a dozen in the morning, a dozen in the evening. They used to come to my house. We can't do that right now, but I met with them this morning. And it just struck me how much I have learned and continue to learn from them. Right now, they're feeling pretty good, for example, about the protective equipment, but testing has really been our challenge about that. So I learned those things that I wouldn't know, and we make better choices. So that second principle of really directly engaging with those closest to the work. And then the last thing I'd say, just to round it out, Tom, is that I think you really have to focus on how you manage your own energy through this, because you have to be the deliberate calming force and a thoughtful one at that. And I was talking to Tom about this, but one of my dear friends is Michael Fisher, who runs Cincinnati Children's Hospital. Learning from others is so important. And he said that he's gone from his to-do list to his to-be list. So how do I have to show up in this day? Is this a day I have to be generous? Is this a day I have to be inspiring? Is this a day I have to be really disciplined about what I have to do? He works and reflects every day on how he's to be rather than what to do. And I will say that if you approach, especially times of crisis, with technical solutions or as a technocrat, you will lose the trust and authenticity of those with whom you serve. So I really think that to be is really an important part of that. Not that we don't have to get to done things done, we do, but we have to think about the hearts and the hands that go together with it. So that focus on purpose and connection, the directly engaging with the people who are closest to the work and never losing sight of what they're challenged by and what gives them jolts of joy. And managing your own energy, I think, at the same time, so that you can be deliberate about how you lead through.
Well, thank you, Penny. One thing that really struck me in with what you just said was that leadership is having thin skin. I think a lot of those of us that have been in leadership roles have been taught something different, and I think it's really a very powerful message. The other thing I would say is your comment on calmness. I have to imagine that's one of those things that also served you well when you were a clinician and things went awry, and I know we've talked about that. Shifting topics a little bit, and I have direct experience with this, but I think it's also something that would be helpful for our audience, and that is, how do you work with the board in the context and the governance entity in the context of a situation like this, and even more broadly? I think, having had the good fortune of being on a number of boards, you have a lot to teach on that front.
Yeah, I think that, I came from, I serve on a few boards now, and I came actually from our board of directors, which was as a doctor who was elected to the board, and that was good perspective to have, having been in that chair. But the board is really, we're a not-for-profit organization, and it's really it's for any for-profit too. It's the constancy of will and purpose is driven from the board. And so that's the continual thread that has to run through. And we just have a fantastic one. You can imagine that because Tom is the chair of it. But we have just a fantastic board. And I think the best thing, the best advice I ever got when I'm serving on boards and working with our board is there was a wonderful, if you haven't read it, there's a wonderful article by Ken Dayton, who's well known in our territory, led Dayton's and Target Corporation, what spun into Target. And he wrote an article called Governance is Governance. And my favorite quote from that is that the role of governance is to get their arms around things without getting their fingers inextricably in them. And we have, I think, that really good balance of, boy, and Tom knows it, we have relied on our board to make sure we get the right perspective, that we take the right actions, that we're focused on a broader horizon of not what we will recover back to, but what we recover forward to, and go forward. And both on, how can we make care better, and how can we make sure that we deal with systemic racism and social justice in the best way. So dropping down further, we've gone very specifically into, okay, what should be our strategic assumptions going forward? We went from 50 virtual visits a day in our organization to 5,000 with COVID. Shows you that actually healthcare can move fast if it needs to, and is connected to that purpose. What should we continue? What is it going to look like after this? What kind of partnerships do we need to form? So that guidance from the board is critical. And then I'll say, being real and hope, those can live together in the right ways. Facing the brutal facts and maintaining optimism is something that's really key, and and you best serve with the board to do that well. So just 2 weeks after the George Floyd killing, we had a board of directors meeting, and I would say it's probably one of the powerful meetings we had, where we could have gone into business as usual, and we didn't. We stopped. We had our leader from our organization who leads culture and diversity and equity just really open up a dialogue about how people were feeling personally and what we could commit to collectively and how we should move forward and how patient or impatient we should be. And so I think that dealing with a good relationship with the board deals with the reality of things, doesn't, is always truthful, always open, always wants the board actually to press on issues that we might not have right. Last thing I'll say, Tom, is that one time I was on a board and somebody said, yeah, I served on that board too. I think we were mushrooms in the dark, fed some manure, and that was about, and asked to check a box. That's not a good board relationship, and I'm grateful that the ones that I'm on and the ones that probably many of you serve on do it in the best possible way.
Well, Penny, I have a very fond recollection of that board meeting, and actually it was preceded by the committee meetings that led into it, where, anywhere from the first half an hour in the committee meetings to the first in excess of an hour was a time of reflection that you suggested. And given the makeup of the board with people from all different kinds of industries, including professional sports, financial services, the healthcare industry, you name it, to hear their perspectives on that and how Allina should approach it, and then also to create a spirit of sustaining that energy going forward, I thought was really powerful and a testament, I think, to your openness and willingness to engage in a meaningful way with the board of directors. And I'm glad you brought that forth, because I do think in many cases boards serve a more perfunctory role. I can tell you, I don't think anybody who serves on the board of Allina feels that way. They feel like it's a very engaged and meaningful role that's played by the board.
And we need it. That's how we can get better. So we really, taking that wisdom to account and using those life experiences collectively is how we get better. And it's been when you see that healthy relationship, you see how much more powerful it is that you can grow for the organization, for the community.
So one other topic before we get into breakouts, then we'll have another 20 minutes after the breakouts to continue the discussion. But you made a transition from an individual contributor, as we'd say kind of more broadly, but a doctor working directly with patients, many of whom, when I'm in public with you, come up and say marvelous things about your relationship with them, to being a leader in an organization. Talk a little bit about how you made that transition, especially for some of those on the call here who might still be in that individual contributor role, but are looking perhaps to take a leadership role.
Right. And I know this is true. I know there are many physicians on that call, but I know this is true of us, and I found to be true, where you are responsible for somebody's care, and you're basically almost fully responsible for their care. There are some team elements, but you're fully. And then as a leader, you have to realize, oh boy, I have to surround myself with people who think very differently than I do, who have very different skill sets than I do, and I have to work collectively with them. So from an individual contributor to kind of a systems thinker with a team, that was an adjustment. And I have to tell you that it was an adjustment that it came easily for me. I used to joke, but not really, that I went from knowing how to do a complex hysterectomy with a lymph node dissection to not knowing how to run my email account. I mean, it was that stark a transition. And then a lot of your identity is tied up in that those personal relationships. And I got to, see, 15, 20 people a day and hopefully make a difference in one life, maybe several lives in that day. And now we were making a difference for people whose names and faces I would never know and see. So it was a difficult transition. One of our board members then, Tom, I don't know if I've told you this, but she came up to me and she said, I can see you're struggling, which bless her heart, I had served on the board with her and I was chief clinical officer at that time. She said, you need to give it a year and see where you land then. And just that grace and space of time and learning, changed my life, and hopefully through that, the support of many others. I also think, frankly, I was advantaged because I didn't come through the traditional routes of being a chief operating officer of this place, that place, that place. I actually knew what I didn't know and could readily admit what I didn't know. And I think that made it easier for me to surround myself with people who had different perspective, different life experiences, and quite honestly, different talents than I had. I knew I didn't know it all, and I could freely admit it, which actually turned out to be to my advantage.
Well, that's a perfect segue, I think, Penny, into our breakout rooms. And we're going to go in there for 10 minutes, and I'll ask you to come into one as well. And if you're not, and I just want to let the whole room know that if you're not comfortable going into the breakout room, you can opt out by just declining to enter the breakout room when the alert comes up. And you'll be returned to the main room until the breakouts are completed. In many of the rooms, there's going to be an alumni or staff member of the Inspired Leadership Initiative or another person who will introduce themselves first as the room lead. If no one does, we're going to rely on you in the breakout rooms to select the lead. Once you're in the room, I just invite you to briefly introduce yourselves, share your location, and if you're comfortable, your occupation and university affiliation. Once you've introduced yourselves, talk about the lecture, and please discuss these two questions, which will also be posted in the room. What have I learned about leading from the discussion? And how can I apply what I've heard to my own professional or personal life? Once you've answered those two questions, please work together to come up with 1 to 2 questions you'd like to discuss after the breakout, and have your room lead submit them to us using the form that was shared with you. We expect that all will follow the rules of civil discourse and that you will respect each other's comments and debrief, because 10 minutes is going to fly by, I can tell you that. We'll reconvene a little after 1:40, and we'll be giving you a 2-minute warning so that you'll know when to wrap up the conversation. So we'll see you all in 10 minutes, and I'll see a few of you in a breakout. Thank you. Well, welcome back. I'm guessing that final 2 minutes went as quickly for you as it did for us, it flew by. As we mentioned, we invite each of you, your room leads, to fill out the form that you see in the chat function to submit a question that you'd like Penny and I to discuss. A number of them have come in. The link to the form is going to come through again now in chat for those who don't have it. In the meantime, I'm going to start with some questions that were either submitted in advance or that we've already received. And the first comes from Melissa in Pennsylvania. And the question, Penny, is do you have a hope for a future in the U.S. where healthcare and insurance industries embrace a broader definition of wellness than what exists today? This would include nutrition, functional and integrative medicine, homeopathy, and spiritual practices. It's quite disheartening to hear the media focus solely on the need for a vaccine to solve all the problems of COVID-19.
Boy, Melissa, I think it's a fabulous question. It's one of the things that our strategy is grounded on, is that it's, health is not the absence of illness. I learned this long ago from a community elder. It's, having, security in your life, a roof over your head, a job that has meaning, connections to the community. That's what health is about. So we fashion ourselves to try to address that. And then I do think that this is a huge opportunity. This is an inflection point. I got asked whether we should actually, work more to reward the best quality experience and outcomes, which goes totally to your holistic view of things per dollar spent. That's really the value equation, and we are going to do everything possible for our organization and us actually leading others to do that. But you are right. That's a definite definition of health, as at least my patients were always my greatest teachers, and they wouldn't define health as merely the absence of illness. I do worry about, we're all worried about vaccine, I get it, and you are so right, because I worry, for example, about what impact does loneliness and physical distance and mental health, and how does it exacerbate that? So thank you for the question, and thank you for pointing out what we have to focus on collectively as true health and well-being.
So a tune from Woodbury here in Minnesota, Penny, had a question which gets to something which actually is a thread through a number of questions. And that how is Allina dealing with the loss of revenue due to the lack of elective surgeries and everything else during the pandemic? So something a little more focused on the financial side.
Yeah, it's been tough. First of all, not-for-profit healthcare, across the country has had a very thin margin to begin with. And so it's usually typically in the 2 to 3% mark. Even though we're a $4.5 billion organization, our margin is usually about 120 million, or so. So we went into this, already threatened to a certain degree and having to actually reduce costs. I think that this is tough right now. We're sitting and we're probably representative of many where we've grateful for CARES. First of all, we dropped to about 45% in terms of our volume of services being done. And that came with significant financial loss. We're up to about 90% now, so it's coming back. And we're running about flat now, but even with the CARES funding, we will have a significant hole financially to place. I guess the tough thing is getting out of that hole will be very challenging. And I think some healthcare organizations, just as some educational organizations, will be threatened by that, and their very existence will be threatened. We will come through it. We have a strong balance sheet and the like, we'll come through it. And I think it's severe enough where, to Melissa's questions before, it will actually stimulate change. We realize now when you go from 50 to 5,000 virtual visits a day, that you don't need as many rooftops to take care of people. We realize now through programs like tele-addiction services that actually a lot of people who are struggling with addiction actually prefer kind of remote caregiving. So we're realizing ways to make things better without the intense capital costs of healthcare today and make them more holistically focused. So I think if we do this well, we will change for the better, but it's probably because of the significant challenges that will stimulate our need to make those difficult choices and make the changes that have been hard to date for healthcare.
So Penny, there's a question from Phil in New York, actually one of the alumni of our program, that plays off one of those themes a bit, and that is, what role does the hospital's physical presence in the community play in being able to respond to the pandemics? And then he also asks, thinking about people who are saying everything will be virtual in the future, and how will that change that physical presence in the community?
Yeah, really good question. So I think that, just specifically, I think that I think there's been maybe a renewed appreciation for healthcare and healthcare providers through this. Many people were challenged by the cost, uneven quality, and experience of the hassle of healthcare. But I think there's been a renewed understanding of that healthcare is really needed when it matters most. In this pandemic, it did. And the gratitude for the people who are caregivers who are pouring their hearts out at times like this, at some concern for their own personal safety during this time. So I think that that's come into play. The hospitals played a huge role in this. For our hospital system, it takes care of about a third of the COVID infected lives in Minnesota. So I think that that's been traditional. We've also worried about the people who were not getting care. We have seen, sadly, more complications of people avoiding care now during this, heart complications that we haven't seen before, diabetic comas that we haven't seen for many, many years. So we're worried about people with the virus, but we're also worried about people who don't have it but are avoiding care for that part. As to everything going virtual in the future, I think it's going to be a blend. I think that there are some things, like I mentioned, for telehealth, services, mental health and addiction services are just the satisfaction people are getting from those and bringing care closer to home and having home as a hub of care for convenience sake. I think that will continue. And I think that we have to find better ways to, make sure that human presence and connection is never lost. And there are things for which just require almost literally and figuratively human touch and will require in-person care. So I think it will be a blended model going forward. I think that low acuity care, sore throats, maybe a cold, those things, unless they were associated with this virus, those things that could be taken care of easily will probably be commoditized to a greater extent, but we'll still need organizations that can deal with the complexities of life and all health-related social needs that affect that life, and complex healthcare conditions as well.
So Penny, the next question comes from the person who I'm fortunate to have as my co-director, Chris Stevens, who is moderating a breakout group. And he asks, how do you quality control on the issue of authenticity through a large organization?
Wow. Wow. I'd love to see, this is the time where one of the monikers of a good leader is to throw the question back. Boy, I'd love to ask that of you and Chris, Tom. So that would be great. I mean, I don't know. I'm hearkening back to my my daughter's grade school when one of her teachers told us, we were so afraid whether she'd have self-esteem, whether she'd thrive, whether she'd do it. And one of the teachers told us, your daughter can smell fear. And I think that, and she told us that it's like, back away, let her find her way, let her do those things. It was great advice then. And I think that people can smell when people are being less than honest, less than real with things. And as I said when I was giving my comments, there's no question that realism and hope can coexist. You can't be all based on the real facts and see no hope. You can't be all hopeful and be, blind to what the facts are. I think those two things can coexist. And I think when you're balancing that coexistence, that's what people, and doing it in a real way and admitting your own failures, that's when people see that authenticity.
Wonderful. So this comes from Kathy in Texas, another ILI alum. She asked, can you talk a bit more about the difference between governance and management and how to help board members who are passionate about an organization or cause and help them to elevate to think about governing rather than doing? Yeah,
boy, Tom, really, you do this so well. This is another time where I'd love to turn it to you. I do think that you really need to rely on the expertise of those community board members who have just such a wealth of experience. And so what we try to do is really focus on larger strategic issues or issues that are facing us and get their guidance, always prompt key questions that we're thinking about, ask them what we haven't thought about, be really open to changing things. I'll tell you an example recently where we were, on this path of, we've got to recast our 3-year financial projections. And our board said, in my business, it doesn't look like we can predict 3 years, let alone 3 months right now. So what if we shorten the time frame of that and do a different rolling forecast for finances? So that's an example of, being open to the comments, asking the questions, and actually responding as an organization to that wisdom that's created. Now, there are times where, and Tom and I have navigated through a couple of these, where people get too deep into the managerial, aspects of things. And I've just found direct conversations with, hey, that should be on us to handle. We should handle that. Who supports this? Who should lead it? What that looks like, that's a managerial piece. So we've also just been really direct at calling when that occurs as well. Tom, I'd be interested if you had any additions to that as well.
Well, I think the guidepost for me, Penny, as much as anything, is that ultimately I view a board as having one employee, and that is the CEO. And that it is, ultimately that person serves at the pleasure of the board, and that individual is the person that we hopefully can empower to affect the change. But that once the board goes much deeper than that in a detailed way, that's when the alarm should be going off that you've crossed the threshold of doing the right thing. And that line can be in at slightly different places at different times, depending on the expertise of the board member. But I think having a high degree of sensitivity to that is something one needs to have to be an effective board member.
Well said.
So I'll shift now to Mike from Denver. And he asked if you're familiar with the work of Amy Edmondson on psychological safety. He's hoping you are, but in either case, what can senior leaders do to encourage psychological safety in their organizations and cultures? Because in his view, it's not enough to say it's important. One needs to go beyond that. So how do you bake something like that into a culture?
Yeah, boy, I wrote down Amy Edmondson's name right away, and I'm not familiar with that work, but we are just being, this is perfect timing because we are trying to, we have put as sacrosanct, obviously, the safety of our employees and our patients. And that goes with personal protective equipment, but you're making the good point that a lot of the worry about potentially contracting the virus when we didn't know what protective equipment worked and didn't out of the chutes here was a lot about psychological safety and what they might be bringing home to their families in terms of potentially, making them ill. So that was a part of it. What we're trying to merge now is like we have worked on patient safety and going to zero preventable harm as a high reliable organization and all the tools that go with that. We're thinking that's not actually distinct from some of the systemic racism and microaggressions that occur on the psychological safety. So we're trying to merge those together right now to say, wow, let's give people an understanding, eyes wide open about how that could merge. So I'm anxious to actually learn more from you or from Amy Edmondson's work about how to do that, because that psychological safety probably trumps, some of the even, more technical safety. I think you're talking again what we talked about at the beginning, which if you approach things technically, you're missing out on a larger picture of where the hearts and minds are of people.
There's a question, there are a couple questions here that come from two different Hoosiers, Tuck and Marty. And they both get to kind of a characterization of your leadership styles. And I think your reaction around this would be interesting. One is a reciprocal leader. The other is a servant leader. And then also, just some perspective on how you deal with somebody, because everybody who is a leader has at a time not been a leader. How do you deal with somebody who's not a servant leader, but is really a prima donna? What would your suggestions be there?
Yeah, it's good. I mean, a reciprocal leader is a new term to me, so I'm anxious to learn exactly what's meant by that. I do think that this whole deal is, it's really at that top of Maslow's hierarchy of needs pyramid, right? Where at the end of the day, when you get to the self-awareness, you're really getting to a point where you serve something larger than yourself. I think I may be advantaged in a certain way. We have a whole lot of people here that are attracted to healthcare because they are attracted to serving others. I've actually had less of a time with that than actually letting people know it's important to serve themselves, to manage their own energy at the same time, because part of their identity is giving to others and receiving. As my wise 84-year-old neighbor across the street taught me, receiving is the same as giving, because you have to actually be able to manage that energy, as we talked about earlier, to be able to give to others. So I think that that being, and catching people on, how their perspective. I'll tell you, every interview I ever have, I always ask of people, tell me something you were part of or led that went wrong. And as soon as they start saying, well, it went wrong because this person did that person did that, rather than saying, well, here's what I learned from that, and here's what I would do differently next time. That's an automatic disqualifier if they're just pointing fingers outside of themselves. So I use questions like that as a screen to that going forward. But I think the culture, the culture breeds more of itself once you get a healthy culture. And so I'd have to say that, I'm sure we're not devoid of prima donnas. I have to handle that less and less.
So a couple of questions that come up through students, and I think they bring a really interesting perspective to this. The first is, you have experience as a provider and administrator, a wide perspective. What would you suggest to somebody who's brand new to an industry, a college student, to learn about the industry, to learn what matters most? And a parallel question, I think, is what was the best habit you practiced while trying to gain perspective during your career?
Yeah, probably the two are the same in my mind. I think it's really looking at things from different vantage points and asking a lot of questions. So, you know, asking those of all people throughout your organization, whether they're supporting the care, a nurse by the patient side, an environmental service worker, somebody who's working in technology and data science, somebody who's leading. So get a palette of perspectives from around, and you will learn more, and actually, quite honestly, have stories to share about that amplify things. Storytelling is really, I think, important in all of this work. And then getting vantage points from others. We talked about the board of directors before and their palette of expertise and experience, but also, you know, other industries and that have similar things. Like I learned, quite honestly, from a friend of mine who works at Best Buy about how they were thinking about multi-channel retail and how we needed to think, instead of everybody coming to us for care, how we could think about different channels so that we could export care as close to home as possible. So I would say looking at and being open to several vantage points and what you can learn is really important about learning about your own self and your organization and industry.
So a question from John in New York, another one of our fellows, and he asked if, you know, do you find the federal government in this kind of a context to be helpful or a challenge? And how do you manage governmental entities generally as a leader of a major organization? And I think here, state, local, federal, all kind of are fair game.
Yeah, I think you know, it's probably a combination of both. I feel pretty good here. We have, for whatever reason, and people have cited some, we have here a pretty collaborative environment in our state and community. So all the health systems have been working together, the large health systems, you know, about how we make policies consistently, choices consistently. And then we've been meeting with the governor and governor's office or commissioner of health, you know, on a very regular basis. So I think those constant communications and alignment for the community's good rather than an individual's good. We just committed very early, we weren't going to have a tragedy of the commons. We were going to not just self-optimize, especially when the community needed us the most. We were all going to work together on that. So I think that perspective is really good. It's been hit and miss. The supply challenges have been very, very real, and those have been a challenge. And yet at the same time, on the federal side of things, I've been grateful because I've had direct conversations with the Center for Medicaid and Medicaid Service Administrator, Seema Verma, about what we should do differently in healthcare going forward. So I would say it's been both sides, you know, of that equation. Some frustration for sure, and some actually looking at this as an inflection point for how much better could we be.
Okay, there are so many other great questions here. I wish we could keep going on. I'm just going to ask one more before we ask for a quick response, then I'm going to have to close it because our hour's almost up, and you've been so generous giving us this time. But the last question is from Bill and another Minnesotan. There's a disciplined understanding. A lot of times we think we understand and stop there. We buy in, but often we don't understand. How do you and how does an organization keep asking why so that they truly do understand?
Well, I think that's such an important question, Bill. And I think that the questions, we were talking about this in our small group session, the questions are so much more important, and that curiosity is so important. And I think that that's why we need actually the insights of the people we're serving. And I mentioned never forget who and what you're serving. So what I'd say is in a quick response is make sure you're designing from the people you're serving back than from your leadership team or your board down. And that's probably the simplest way I can say it, and just never lose sight of that point of service.
Well, Penny, thank you again for joining us today, and thank you everybody for joining us. I hope everybody found this discussion to be as energizing, insightful, and inspiring as I did. I've had the great opportunity to work with Penny for quite a long time, and every time I engage with Penny, I learn something, and today was no exception. I just want to provide a quick reminder that in 2 weeks, we have Dave McLennan, the chairman and CEO of Cargill, who will be joining us. He's going to, and we will share in advance a few short primer videos to get you prepared for that discussion. And we look forward to you coming back and ready to discuss. And also, please feel free to share this series with your friends. We're accepting registrations throughout the entire program. As you can see, each of these can stand alone. And once again, Penny, thank you so much. It was truly wonderful. Always great to see you. And I'll see everybody else in a couple of weeks. Thank you.
My honor. Thank you all. Take care.